Lilium tick acts specially on pelvic organs such as uterus, fallopian tubes, ovaries, brain, vessel walls, and the heart. The drug can produce various types of pathological states of pelvic organ in general and female genital organs in particular. The various clinical symptomatology are due to reflex states depend on those pathological conditions. It leads to forceful contraction and palpitation of the heart. The physical makeup of Lilium tick specially suited to unmarried women who suffer from uterine trouble. There is irritable temperament, nervous temperament, and hysterical temperament. The patient is very hot. There is soramism in the background. Guiding symptoms are it affects principally left side of the body. The patient is hot, so want cold air, open air, cold room. There is bearing down sensation, dragging sensation in abdomen and pelvis, and as if all the organs would escape. The consolation from other aggravates the suffering. Frequent urging to urinate. Shifting pain. Pain lies from one part to another. Pulsation all over the body and full distended feeling as if blood would burst through the vessels. Sensation as if heart was grasped in a vice, as if blood had all gone to the heart. Feels full of bursting, inability to walk erect, claps and unclaps feeling in the heart, as if by an iron hand. Rapid heartbeat 150 to 170 per minute. Mind. It produces various type of mental symptoms like weeping disposition. Cat can hardly avoid weeping, very much timid and fearful. There is profound depression of spirit. Patient is quite indifferent about what is being done for her. Consolation aggravates the complaint. Furthermore, there is great irritability of mind. She can hardly speak a decent word to anybody. She will snap even when spoken kindly to. She is so irritable that her friends cannot pacify her. There is great fear of being alone. About her disease as if she is incurable. Fear of organic diseases of heart and insanity, etc. The patient is very much hurried and worried. Desire to do something in hurried manner. There is aimless hurried motion. There is an irresistible desire to curse and swear. The patient tries to describe an indescribable feeling. There is a wild, crazy feeling on the vertex as if the ideas are scattered, confused ideas. When concentrating the mind upon a particular thing, something else comes back to the mind. There is disposition to curse, swear, strike, or think obscene things. The patient becomes very much listless. It cannot sit still, restless. It does not want to walk. She sits, broods, and thinks over the past, tormented about her salvation. Great sexual desire. She must keep herself busy to suppress her desire. All the above mentioned mental symptoms alternate with physical symptoms and are more or less due to and arising from associated with uterine symptoms. Particulars: uterine symptoms. There is weakness and atonic condition of pelvic tissue, uterus, and ovaries, resulting in anteversion, retroversion, subinvolution from the paralytic condition. There is great bearing down sensation, dragging sensation in abdomen and pelvis, as if all the organs would escape. Relief by supporting the vulva with hand. Here is the difference from sepia. Both have got bearing down sensation and intolerance of sympathy, but support the vulva during prolapse. But Lilium till both support the vulva during prolapse. But Lilium tick feels heat more and sepia feels cold more. Sepia is indifferent and apathetic, where Lilium is always hurried and worried. Tiger lily craves meat, while sepia has got aversion to meat. Sepia has no sexual desire. Lilium has sexual desire. Nevertheless, in order to suppress the desire, she keeps herself busy. Menses are too early, scanty, very much dark and offensive. Flow only when moving about. Flow ceases when she stops walking. Shifting pain in small spots can be covered with the tip of finger. Concomitant bearing down sensation, dragging sensation in the abdomen and pelvis as if all organs would escape. Relief by supporting the vulva with hand. Constipation, causation, inactivity of rectum. During stool, there is great tenesmus in rectum with mucus. Urging sits for a long time in the closet to pass stool. Although there is great urging and great staining, no stool or little stool passes out. Along with frequent urging to stool, there is sensation of ball in the rectum. Due to introversion of uterus, there is sensation as if rectum were full of feces, which brings on repeated urging to stool, and the patient sits and only stains but no stool passes out. With desire for stool and bearing down sensation in the abdomen, there is great pressure in the rectum. Urine, great tenesmus in the bladder, the patient sits for a long time to urinate. Frequent urging to urinate. If the desire is not attended to, there is sensation of congestion in the chest. The urine is milky, scanty, and very hot. Very hot. Heart symptoms. All the heart symptoms are associated with and arise as the reflex symptoms of uterine trouble. Sensation as if the heart was grasped in a vice, as if all the blood has rushed to the heart, which feels and seems like bursting. There is a great palpitation with fluttering, faint, hurried, and anxious feeling about the apex. Pains are sharp pain in the left chest, shifting in the nature, flying from one part to another, and can be covered with the tip of finger. Pain in the cardiac region with feeling of load on the chest. Pulse is very much rapid and irregular, with rapid heartbeat 150 to 170 per minute. Aggravation after eating, lying on either side. Concomitant pulsation all over the body. Full distended feeling as if blood would burst through the vessels. Heart symptoms alternate with uterine symptoms. Sweats, there is a coldness of the whole body. Extremities cold and covered with cold sweat. General aggravations by consolation and in warm room, and amelioration in open fresh air. Antidoted by platina, nux vomica and pulsatilla compared to cactus, murex and sepia.